The Biden administration is formally recommending coronavirus booster shots for millions of Americans. Officials yesterday cited evidence of waning vaccine effectiveness over time as the reason for the move. People who receive the Pfizer or Moderna inoculations in the early stages of the vaccine rollout could be getting a third jab as soon as next month. Bradley Blackburn is following this story, and he joins me now. Bradley, good morning.
Hey, Laura, good morning. The president and federal health officials say that they're trying to stay ahead of the virus with this third round of shots. They argue it's the best protection we have against the Delta variant and any new variants that might be spreading. Americans will soon be able to get coronavirus booster shots.
It's the best way to protect ourselves from new variants that could arise.
Starting September 20th, pending approval from the FDA, the shots will be offered to people who received the Moderna or Pfizer vaccines, as long as 8 months have passed since their second dose. A booster plan is still being developed for recipients of the Johnson & Johnson vaccine.
You don't want to find yourself behind playing catch up. Better stay ahead of it than chasing after it.
Federal health officials cited recent studies showing the vaccine's protection lessens over time. They also stressed the importance of getting immunized.
One thing is very clear. Getting vaccinated can keep you out of the hospital. Getting vaccinated can save your life.
Most experts agree. Medically, they see no downside to getting a booster dose.
At the end of the day, is it going to be harmful? No. Is it going to be effective? Possibly, but probably more effective in some groups.
The World Health Organization, though, has expressed concern there may be a downside that Americans getting third shots will take vaccines away from countries that still don't have enough initial doses.
I do not accept the idea that you have to choose between America and the world. We clearly see our responsibility to both.
The Biden administration says it has sent more than 110 million doses overseas and plans to donate 500 million more. And to give you a sense of the scale of this problem, the WHO says 11 billion doses are needed to control the pandemic around the world. And Laura, we know it is a global fight to try to slow the virus before new variants can form.
And on that point, there has been some criticism. The World Health Organization's emergency director compared this booster shot to, quote, handing out extra life jackets to people who already have life jackets. So how's the White House responding to that?
Right. WHO officials sharply critical of the U.S. plan, Laura, but the White House essentially says it is not fair criticism. The U.S. can do both, provide boosters and donate vaccines around the globe. And again, they say they are making this decision based on new science that shows the current 2 doses lose their effectiveness over time. So, Laura, the belief is that that extra life vest might be the only way to stay above water.
Interesting. Bradley, thank you.
Thank you.